Rob, one of the two words that were used at the end of your session was medical and device. Do you want
I think it actually gives a level of quality to it. And I think actually if it is a medical device, then so be it. I mean, for me, it's just how we want to categorise. I think actually over the last, 5 years, the whole kind of registering a medical device has been quite interesting from a regulatory perspective. But no, it's not something that fills me with dread. And I think actually there's a device an app that we've already launched in asthma that's going down that route at the moment. So I'm fortunate that my colleagues on the respiratory side have already treading a path, so I'll have some kind of learns on what to do.
There was a question. Did you put your hand up before? Do you want to?
Hi, I'm Sharani from Merck. We've been developing an app recently and had some major challenges with information governance and a number of the trusts. I'm wondering if you've experienced the same sort of challenges and how you've gone about overcoming them.
Yeah, so I think obviously we're in that pilot phase, so I think there's definitely strong governance around the data and how that's stored. But I think, as I said, in kind of answering the last question, I think that the luck that I've had in terms of having colleagues in a different department already doing it, they've kind of gone through the painful journey over the last kind of 2 or 3 years. So I'm just kind of saying we're doing a similar thing. What are we doing? And we're set up to then manage that.
Cool. Hi, Rob. Kush Raj here from Be More Creative. One of the challenges that we find when we're working with our clients when it comes to ideas like yours, which I think is brilliant, by the way, is how do you ensure longevity of the project? So, you know, who's in charge of that in terms of who's going to take over after perhaps you're not leading it, or what patient groups, how are they planning to keep this going after 18 months, 2 years or whatever? So I think like any app, my kind of like vision with that would be is that, you know, you need to update it like you would with any app. I think the way in which you want to manage that is not every month. It's kind of like, say, you're going to do a biannual update to it and make sure we're budgeting for that globally to help with the infrastructure. I think obviously what we'll need to do is market by market. The LOCs will need to manage that as well and put budget in place. So if they want to opt in and have it for that country, then they're going to need to do that moving forward. And actually, you know, there will become a point where actually it's not useful and there'll be new technology that takes place, and then fine, step back. I think if I look at patient support, when I joined the industry, as Carwyn kindly mentioned, I've been at GSK for almost 20 years. In fact, it's not true because it was GW back then, but GSK didn't exist. So, but I think when I joined the industry, it was all paper-based, patient diaries, lots of print, lots of cost, and so that's kind of obsolete now. And I think there will be a point where that happens. So I'm kind of happy for that, but we just kind of want to move with the times.
Okay, any others? Albert, one for you. You mentioned about mobile. It was more in Europe. I can't remember the number. 92% Europe, 91. 82% in US?
91 in Europe, 81%.
Why? Would you know why?
82%. Look, I was talking earlier to a colleague of mine. I mean, I think it's cultural. We honestly have not adapted as much into mobile devices. I think a lot of physicians, especially with the Affordable Care Act coming on, really felt compelled to go more digital by force rather than by choice. So I think that has something to do with it. So I think asking people to change habits is a lot more challenging. They're not being mandated previously to change habits. Now they are, and I think when you're dragged screaming to something rather than evolving into it voluntarily, it presents a challenge. So I just think in terms of the market, I've always seen, you know, and it's not just limited actually to medicine. I mean, when I look at culturally America versus Europe, there's a lot of things that you guys do. Credit card, great example. We still have to sign all the time rather than use a chip and a pin. The technology industry in the United States, we're kind of stuck in our ways, and so I think it takes us longer to evolve toward it.
You do have culture, though. You have some things.
Yeah. We have some.
And the other question I wanted to ask you, there'll be people in here, UK people and European people, we're all sweating mildly about disclosure of payments. and they had the Sunshine Act coming to Europe, into the UK. It has to be reported from, someone who correct me, July this year, the previous 12 months, whatever it is. Have you seen anything? Has that impacted what you do or what pharma does with you with regards to payment for physicians and all that?
In the U.S.?
Yes.
Oh, yeah, massively, yes. A number of years ago, massively influenced the amount of payment that you could give physicians to do something, the amount of reporting and recording of what you had to do in terms of if they did a speaking engagement on the behalf of a sponsor, what was the honorarium associated with it, and also then dealing with the caps and understanding not only what is that clinician doing with you, but what is that clinician doing with the variety of other providers is also, which you may not have enterprise-wide visibility into. So, yeah, it is a challenge. I mean, it remains a challenge, and it's just led to more documentation, more paperwork, and it doesn't make it as easy as it used to be, for sure.
And is it transparent? Can patients see it?
No. But it is transparent, within the medical community. It's not something that we're publishing out. I mean, I guess you could find it if you wanted to, but I don't think that it's readily available to consumers.
We'll do one more question if anyone's got anything else to ask. Yeah, one more.
Christian from Pharma Forum. Just a thought, there's obviously an increasing amount of patient support programs, apps, the movement of more e-patients. I just wondered, Albert, from your perspective, how do you see the doctor community accepting that movement at the moment with having more patients coming into, consultations with wanting to have more of a kind of level conversation, if you like, given the increasing amount of information out there?
Yeah, and look, I think that's the holy grail, right? I think ideally what we all would love to do is to connect those two audiences. And the one thing that we've been able to do, which I think is really starting to test the waters, is looking at data, big data on both sides, and how do I use that to maximize communication strategies. But to your point, the idea of true connection through an application, through a mobile platform, through some sort of social platform is definitely something that we are actually actively exploring. But again, the regulations and the laws and HIPAA violations in the United States, really have to create a secure technology environment in which we know it cannot be compromised. PHI creates a problem, personal health information and potentially access to it, and also creating a comfort level within the patient community that indeed when I engage through this, I am secure. No one's going to get access to the fact that, I have eczema or what have you. Look, I think it's somewhere where we will go, for sure, and I know we are on that path. I think it's going to take us some time to get there, but I definitely think consult is the first step toward it.
Great. Right. Before we thank you, Albert, you're leaving at 3:30.
I am.
Okay. If anybody, the WebMD team, there are people from WebMD here. Put your hands up, wave. Yeah, okay. And you're here tonight as well? Yeah. So if anyone's got any questions, try and recognise those three, or they'll stalk you probably with business cards during the evening, maybe. I don't know. But if any other questions about WebMD, again, chat to those guys there. Rob, you've got a call at 6, but you're around this evening as well?
Yeah.
Yeah, okay, perfect. So Rob's here as well, so anything you want to follow up with Rob, please chat to him in one of the breaks or also this evening. But please join me again in thanking Rob and Albert.